So first question is from Michelle, and she is from Houston, Texas, and she's talking about weaning off of mirtazapine. So when weaning off of mirtazapine because of weight gain only works great, really. Can you add in another medication like trazodone to help offset the withdrawal symptoms, or should you completely wean off of it first before adding a new medication? This is a good question when we're talking about deprescribing. So the reason she's getting off of this is because of the side effect of weight gain. It has nothing to do with being too sensitive to the medication or having tolerance or, feeling as though the medication has stopped working and now she's having tons of issues. If that were the case, I would say no. However, in this case, she's just wanting to switch basically to something else to help her with sleep and something that does not have the side effect of weight gain. So yes, you can add in something like trazodone. However, you will have to be monitored closely off of mirtazapine. And when you add in the trazodone, it would have to be at a very low dose. Like I would start at 25 milligrams. And then as you're slowly coming off the mirtazapine, you would slowly then increase the trazodone. Now, a good website to have your provider go to would be the switchrx.com. So that would be the website to, let your provider know about. I believe you have to be a provider to sign in. Maybe not. I can't remember now. It's been a while. But switchrx.com will help when you're switching from one antidepressant to another or one antipsychotic to another. It gives you a good guideline on how to do that. Okay. Should HRT, this is from Erica Hull, should HRT be the first treatment for anxiety at menopause? No. What you want to do at menopause, though I know what you're saying with hormones can be out of whack, what should be the first thing you do is do your labs and then decide what is causing the anxiety. HRT can be a treatment option. First treatment option shouldn't be an antidepressant or an anti-anxiety medication, but sometimes it has to do with dietary deficiencies and things of that nature. So get your labs checked. I have a video on mental health labs, and I do like to look at estrogen, testosterone, progesterone, but also looking for things like B12, folate, vitamin D, your inflammation, is your gut, are there signs of gut inflammation or gut dysbiosis? Because as you get older, those things also become prominent. And so with HRT, that can have a lot of side effects as well. And so always start with the foundational things, cleaning up your diet, fixing nutritional deficiencies. If there's any signs of gut, dysbiosis or microbiome challenges, fix that gut first. And then actually you'll notice that your hormone levels will go up. Another thing that can cause hormone levels to drop in later life as well is not only the fact of menopause, but your adrenal function, especially if you're in a stressful environment regularly. Adrenal dysfunction can be a problem. And so, and when you have adrenal dysfunction, then your DHEA, your pregnenolone isn't working properly. And those are precursors to all the other hormones. And so you want to make sure you have a provider that is understands hormones in that regards and is looking at the whole picture and not just singularly, your estrogen, testosterone, or progesterone. Okay. How does someone on very long-term use of almost 8 milligrams of Xanax and 2 milligrams of Klonopin daily for almost 20 years get off while being able to function? Good question. The thing with benzodiazepines is that you can get to this point of tolerance and withdrawal. I'm not sure if that's where you're at and that's why you're asking the question, but if you've been on them for 20 years, then I imagine that you may be at this state, especially if you're at 8 milligrams and of Xanax and Klonopin. That combination in and of itself should not be given from a provider. I hate to say it, but that would be like, malpractice, in my opinion. Those are two very strong, potent benzodiazepines. So that is a whole separate topic. But You would want to start off with the Xanax first because clonazepam has a longer half-life. And you would want to, by rule, decrease by 5 to 10% every 4 to 6 weeks. You can do, if you want to try like a hyperbolic or micro taper, and then go down every day doing like drops. If you want to do it that way as well. There's different methods to do it, but definitely it's not going to be easy. You're going to have to get those medications compounded because you can't get those low dosages at a certain point. So when I say compounded, I'm talking about getting the medications in liquid form. And then also being with a provider, talking to a provider who understands benzodiazepine tapering and withdrawing and can help you. Another thing to think about during this time is, of course, labs. I always go back to the labs and what's going on in the body underneath and making sure you're correcting any deficiencies. Though if you're at this point, you may be very sensitive to a lot of supplements and things of that nature. So if you find deficiencies, really leveraging diet to help to correct those deficiencies. Next question from Elias from Denmark. Hi, Elias. Are tricyclic antidepressants more effective than SSRIs and SNRIs? I am starting on nortriptyline next week because the newer antidepressants have not been effective for my depression. I have done mental health labs and I'm taking supplements for nutrient deficiencies. Okay. Tricyclic antidepressants can be considered more effective because you're targeting two separate neurotransmitters. You're targeting serotonin and you're targeting norepinephrine. And when you're targeting norepinephrine, there's a downstream effect to also target dopamine. So you're getting more robust neurotransmitter increases. So yes, tricyclic antidepressants can be, and in many studies show more effectiveness than SSRIs. But you have to be careful with side effects, and that's the main reason why they are not first-line treatments. So just be aware of that. Make sure you're monitoring yourself for side effects, and then also have a greater risk for serotonin syndrome if you're taking other medications that can act on serotonin. So also be aware of that. And I'm glad to hear that you've done your mental health labs and that you're taking your supplements and correcting those nutrient deficiencies, because that's always number one. And hopefully you found some benefit from that. Awais, which antipsychotic works well with amitriptyline for low self-esteem, depression, anxiety? With this, we want to look at underlying root causes before jumping to an antipsychotic with amitriptyline. So you're thinking of adjuncting. So yeah, definitely looking at root causes first before adjuncting. I wouldn't recommend adjuncting to an antipsychotic with a tricyclic without first looking at root causes.